but I'll just get started. So my name is Matt Kleinmann, and I'm a doctoral candidate at the University of Kansas School of Architecture. I should be wrapping up this spring, but I'm also currently, as of last week, the Director of Community Development and Vibrant Health. I've had a lot of jobs over the last couple of years, but none of what I'm going to present to y'all today would be possible without the work of Dot Agency, which is sort of an informal collaborative that Shannon, Chris, Niels Gore, both professors at KU School of Architecture, and I co-created about 8 years ago to do community-based design in Wyandotte County. And when we started framing, and this is sort of what my dissertation focuses on, it's about community health design. It's sort of this intersection of public health, urban planning, architecture and design, and a little bit of community organizing. And so it's about translating what the community wants to see in their built environment and making it real and making resources accessible. And sometimes that includes designing buildings, but more often than not, it's including designing public spaces, policies, frameworks, things like that. And in Wyandotte County, where we're located, or where I'm currently located and I currently live, Wyandotte County is sort of a microcosm of the country. Obviously, those of you that are familiar with it, it's very urbanized, but it's also suburban and rural. And there's a variety of demographics. I think we have over 72 languages spoken in our school district. And so it is a very diverse community, but it also has a wealth of just different challenges across different areas and different neighborhoods. So when we talk about racial equity, there's a movement towards sort of health equity zones. And some of that is because of how racism has been played out across landscapes. And we see that through things like redlining maps. Certainly there are other examples of that. But when we look at the social determinants of health and how neighborhoods and communities are considered a part of that, as we're looking at addressing racial health equity specifically, the work of Dot Agency has sort of been having to navigate this work over the last 8 years. And that's what my career trajectory has been on, is how do we work with communities so that they can see the social determinants of health, they can see their neighborhoods and communities thrive in response to systemic, decades of systemic racism and a lack of opportunities. And so just a couple examples of this. When we got started about 8 years ago, we were looking at things like the Kerwin Center or Kerwin Institute, who worked with the Community Health Council to map out where life expectancy was. I think the average life expectancy from Turtle Hill, which is a predominantly Black neighborhood in Wyandotte County, to Piper, which is predominantly a white neighborhood in Wyandotte County, is about 24 years now. And we also see that just in proximity to open space and parks, those same neighborhoods had the least amount of amenities in the built environment. And there were certain areas where there were opportunities to have sort of an architectural intervention. And we used community engagement as our entry to that, as a school of architecture, working with our students, bringing a participatory design process, and also kind of learning from other fields and other disciplines about what's enough. So a couple of examples through this presentation, talking about how we try to steer in towards citizen power and partnership with community members. And we were heavily influenced by public health in that respect, the CTSAs, principles of community engagement we adapted early on as principles of participatory design. So just a couple of fast-paced examples. I think I missed the slide on this one, but this is an example of just, how do you define community? How do you reach those voices that are not often heard? We did a lot of storytelling. When we started work, we were doing stories and videos, working with community members, talking about their neighborhood and validating what they were experiencing. We listened to those needs and we identified who in the community wanted to be a partner in this process. And so we started to develop prototypes in the built environment that could respond to the needs of the community. So for example, not having a park bench to sit on the Jersey Creek Trail, which I can look out and see outside my window. How do you respond to that when the CDC says you can't fund turning dirt? So we had a creative application and we went back and forth with our community partners to actually build something that had a chance to improve health outcomes. Being present and building trust with formal and informal community leaders. We were frequently out in community spaces and where we would meet with youth, meet with community members, meet with leaders, providing resources, and then also on the back end of that, following through and getting things done, which is a huge challenge in this work. We would engage every stakeholder that was affected or wanted to participate. So we did projects in parks where, we might have thought, well, based on this, racial demographic in a Black neighborhood, that's what our primary population that we need to engage with was. But then we'd be there present and it wouldn't be that. It'd be the different demographic, a different community would be using that space. We would develop interdisciplinary partnerships to address community issues. So we were working not just within architecture, but recognizing that public health, public administration, there's a whole variety of groups of urban planning that have similar interests and concerns. So we had to forge those partnerships within academia. Being inclusive of other cultures throughout the design process, especially on a project we worked on to develop a mobile grocery store where there was a cute pig on one of the earliest design prototypes, and a community member said in a Somali Bantu community in Wyandotte County, they'll say that that's not halal meats if they see a pig on the truck. Let's be more inclusive. And so that design process of bringing the community into share ownership and governance was a key feature of what we're doing. Building sustainability in the process is allowing communities to take ownership. So one of the previous slides had a process of mapping community amenities in a park. Well, we did that and we turned that over to the kids of Sumner Academy last year. I worked with the Groundwork NRG team to do a Green Team toolkit where they actually developed their own tool to engage residents to restore vacant lot. And then making sure that the community has ownership and of the outcomes, and that we're flexible to meet those needs. So a few years ago, we did Walk WICO, where the community took ownership of a walking audit process that still continues to this day. And then as recently with the Health Equity Task Force in Wyandotte County, developing clean air boxes where we're not just only helping do a project, but we're also sharing the tools on how to build your own. And so the last sort of step on this is that effective participation with communities means long-term engagement. And so I've been fortunate to be a part of the Health Equity Task Force until just a week and a half ago, which is a collaboration between community leaders and the health department. It takes a lot of work and it takes being around for a long time. But I think when we're trying to address some of these wicked problems like racial health outcomes in the built environment, it does take being around for the long haul. So you're an accessible resource to the community and can bring other resources and other opportunities alongside you. And just as a plug, one of the efforts that we're working on starts tomorrow is a film screening for Black maternal mortality. It's in Wyandotte County, and you can check out the website at wycohetf.org, and you can register if you'd like to attend tomorrow. Last thing I'd say, none of this work I'd been a part of a dot agency would have been possible without Broderick Crawford, and he was a huge presence in Wyandotte County. Everybody on this call that doesn't know him, he was a huge leader, and many of you all do know him well. So I just want to acknowledge that Broderick's presence is a big reason that I'm even here to do this work today. And one of the projects that I'll continue on working on is a basketball court renovation project that he and I were working on that would directly address health disparities in the Northeast area. And that's a view from about where I'm sitting right now. So we'll continue to do this work at Vibrant Community Development.